If you are tired of putting in long, hard hours and receiving less compensation from your practice, you're not alone. With declining Medicare and managed care reimbursements and ever-increasing expenses such as medical malpractice premiums, it appears there is no end in sight. Physicians nationwide are constantly looking for ways to increase practice revenue to offset this ever-growing problem. Would you like to know an easy and simple solution that can increase your per-patient revenue? Can you say, "Back to the future"? Years ago, it was a common practice for physicians to dispense medication to their patients. The time has now come again for physicians to dispense. It's fast, easy, and benefits both you and the patient. You can substantially increase your revenues without having to see additional patients with MedX Sales' simple, easy, and highly profitable dispensing and mail-order drug solutions. If you see 20 patients per day and generate only one script per patient, you can enhance your income by as much as $50,000 a year. Ask yourself, how much money are you losing today by not dispensing? It's not often you will find a way to make a considerable amount of money without any additional effort. The MedX dispensing solution is a simple cash and carry program that requires no insurance processing, which means you get paid daily and takes less than 60 seconds to provide the needed medication to your patient at the point of care. Instead of handing your patient a script to make a wasted trip to the pharmacy, you will dispense prepackaged generic or name brand medication from an FDA-approved repackager. Most of the drugs that you will dispense to your patients will be generic. Stop giving out samples that ultimately cost the patient more time and money at the pharmacy and provide no financial benefit to you. With many generic medications costing around $5 per bottle, it is very easy to realize a profit of $10 per script and make it very affordable for your patients to purchase medications from you. If your patient has a prescription drug card, we suggest accepting the generic copay, which is typically $15 to $20 today. And it gets better. Were you aware copays have increased 400% from 1999 to 2003? It is projected drug copays will continue to increase, and as they do so, so does your income. If your patient does not have a drug card, simply charge them the regional cost for the medication found at the pharmacy. Ultimately, you can charge any amount you wish. It is totally up to you. The MedX dispensing solution also offers many advantages to your patients. Did you know, on average, 30 to 40% of prescriptions never get filled? The patient can take advantage of the convenience of receiving their medication directly from you, as opposed to wasting an added trip to the pharmacy and waiting for their prescription to be filled. By dispensing the prepackaged medication, you can ensure your patient is complying with your orders and is receiving the medication they need to get better. Dispensing in your office also helps maintain confidentiality for your patient. You may ask yourself, I am not a licensed pharmacist. Can I dispense drugs to my patients? As a physician, it is your legal and business right to dispense highly safe and effective medications, but only to your patients. All the medication comes prepackaged and pre-labeled in the strengths and quantities you normally prescribe. There are no pills for you to count, and there are no long-term commitments or strings attached to try the MedX dispensing program. Patients will receive their medications and easy-to-read instructions before leaving your office. The key to dramatically increasing your income and being highly successful in dispensing is to develop a fine-tuned generic formulary specific to your practice. There should be no out-of-pocket costs to you because, as a cash and carry program, you are collecting your money prior to receiving an invoice. Simply complete a short form with a list of drugs you wish to have in your formulary, and a MedX sales representative will provide you with a profitable dispensing solution. Dispensing medication to your patients is back and is here to stay. It is not a fad. The decision that you need to make is not if, but when you will dispense medication to your patients. Once you make the decision to dispense, the MedX sales team will help you every step of the way, from inventory and cash flow management to maximizing your profitability. Are you also seeing workers' compensation patients? Please let your MedX sales representative know so they can explain to you our program designed especially for workers' compensation. Highlights of this program include no out-of-pocket costs, inventory management, no claim processing, and most importantly, guaranteed payment to you in 30 days. Some physicians have literally doubled their income with this program. It is time to give dispensing a try. All you need to do is contact your MedX sales representative to get started on the road to profitability. At MedX Sales, we care about you, the physician.